With us now is Dr. Ronit Adler. She's been a guest before. So excited to have her back in. Welcome. How are you?
Thank you. Thank you for having me.
I wanted to have you back in because it seems like you're one of the most innovative pain management people, bar none. You just keep staying ahead of the curve. So now, one of the things that we talked about last time was using PRP for cosmetics, but now you've been using it for pain management, especially with athletes.
Absolutely. What PRP generally is the extraction of the patient's own blood and then purifying it and taking out the most regenerative cells and anti-inflammatory cells, as well as the growth factor that's attached to the cells, and re-injecting it into an area that's inflamed, injured. So what a lot of things have been happening is that the athletes, for example, that previously had no available therapy other than surgery or steroid injections, we're now using PRP because there's no downtime, it doesn't require surgical intervention, and it's your own blood. So there's no really downside or complication to it.
Yeah, there's no toxic side effects.
Absolutely.
Because it's you're spinning it, and then you're putting it back in.
Correct.
So is it like an oxygen that goes into your blood? Like what actually is happening? So when you extract it, like how many tubes do you extract? Does it depend on the patient? How does it work, the process?
It really depends on the area that you're going to inject.
Okay.
So other areas require a little bit more than other areas. So
Okay.
The smaller the joint, the less you need. Or for example, if you were working on the back or the spine, you need very, very little.
Okay.
But basically you draw the blood like you would in any lab. You extract the blood, you spin it down, you centrifuge it at a high speed. And what it does is it then separates the blood into different components. So you have red blood cells, white blood cells, and then the plasma and the platelets, which are in the plasma. You don't generally want the white blood cells or the red blood cells because they can cause inflammation themselves.
Okay.
So what you're doing is you're taking the platelets that are your regenerative cells. So for example, if you ever witnessed when you scratch yourself and that yellow goo that forms first before you heal, that's actually PRP. That's actually your platelets coming to the area of injury and then healing the wound. And that's basically what you're doing. You're taking the best cells of your blood components and you're accelerating the healing process. So even in the elderly people, you would think that have osteoarthritis, which is an inflammatory process, you're actually taking cells into almost like a bullet and putting it right where it needs to go. Correct.
Right.
And it really accelerates the healing process.
In your practice, you've seen, I would say, almost miracles happen, but really there's science behind it. What's one case that you remember, without saying a name, that you walked and you were just like so happy because you just knew that you helped them?
Well, that's a funny story because the best result was my husband, who's the biggest skeptic, injured himself while he was at the beach. There was he tore all of his muscles and couldn't even walk. And him being the skeptic, the neurosurgeon skeptic, because they believe that the only way to heal things is through surgery. I said, Jeff, it was a Saturday. I said, Monday, we're going to take you into the procedure room. I'm going to do it under fluoroscopic guidance, which is X-ray, to make sure that you are where you think you are. That's also imperative.
Right.
We took his PRP and we took quite a bit because there was a large area of injury. And spun down his blood, re-injected it, and I swear it was like a miracle happened.
Wow.
And what was so happy for me is that he became from a skeptic to a believer because he saw it firsthand.
And he's probably proud of you. You know, I think you're proud of each other because so he's had success in his practice, you've had success in your practice. And a lot of times, sometimes you treat patients together.
Yes.
Because sometimes it's a combination of things.
Yes. Sometimes, for example, because he is a neurosurgeon, let's say somebody needs surgery, but they, for some reason, don't want it, are afraid, or are looking for other alternatives. That's where we really complement each other because instead of doing a drastic move with downtime and incision, you may not even be medically fit to have surgery. Those are the candidates that would really benefit from the PRP.
Okay.
And now that he's a believer, he uses me.
I like that. You can refer to each other.
Right.
When you are working with someone, what's the first thing that you tell them? Because it's probably a little scary because the technology is still like...
Yes.
Okay.
I usually tell people that there are no guarantees, as with any procedure.
Okay.
The thing I love about this, though, is that for people that don't have any alternatives, it is a really good, viable option. Why? Because, again, it's so benign. There's so little risk factors. I don't even really know of any complications. And you're just taking, it's a holistic approach. You're taking the patient's own blood. You're not doing anything exogenous to it or extrapolating from the norm. And I do also have a light source in my office that came from Japan. So normally what people do is they add products to the PRP. So they'll add anticoagulants or they'll add calcium chloride to activate it. But my light source actually activates it without putting any contaminants into it. So I just love it.
Lovely.
And listen, is it 100% results? Not always. So I like to give people, you know, I don't like to give false sense of security. I say, this is something benign. There really is no downside to it. And what's the worst that can happen? You can only get better.
Right.
You can only get better.
It's worth a try.
And I love that because most things in medicine do carry risk, and lots of it.
Thank you for once again joining us. We love your intelligence. We love your sharing. And we look forward to always staying, you know, right up on that innovation with you. So,
thank you so much for having me, and send my regards to your beautiful daughter, the artist. She's amazing.
It's true. Our girls grew up together.
Yeah.
So there you go. Dr. Ronit Adler. She's fabulous. And if you need some help, no matter where you are in the world, you could reach out to her through email or through her practice, and I'm sure she'd give you great advice. Stay tuned for more. We've got a great guest coming up next.